We are now going to begin our bedside rounds with Mr. Alex Taylor in room 312. As always, let's try to remember to talk directly to him and not just to each other. We'll spend about 10 minutes with him. If one of us needs extra time to go over anything else with him, we can, of course, come back and speak with him later. Is there anything that we need to talk about before we go into the room to see him?
Well, I met with Mr. Taylor and his wife Sue to go over his medications. He was unsure of what he was taking on a regular basis and was not getting his medications from the pharmacist consistently. And now that we've adjusted his dose of furosemide, he could use some additional teaching. I also contacted his local pharmacist and confirmed with his primary care physician his current home medications. There is now a note in his medical record with all of his current medications, including dose, route, and frequency for each. This will assist in us planning his discharge medication reconciliation.
All right, well, we were hoping to send him home today. How far along are we in terms of preparing him and his wife for discharge?
The nursing team has spent some time with him and his wife reviewing his diet and his meds. The dietitian came by yesterday and reviewed DASH diet with him and how to read labels for sodium content. Mr. and Mrs. Taylor told us that they had been eating out a lot lately, so we suspect that processed foods and sodium overload may have contributed to this admission. Tawanda, I believe you're also planning to come by and provide additional discharge education with handouts on medication, correct?
Yes, that is the plan.
Is Mrs. Taylor here now?
Yes, I saw her earlier today.
Well, great. Let's go in and talk to them about discharge plans. Mr. and Mrs. Taylor, good afternoon.
Hi.
Hello.
My name is Dr. Terry. I'm the attending physician on this unit, and we've spoken several times during your hospitalization with us.
Hi, Mr. Taylor. We met yesterday. I'm Tawanda Underdew, the pharmacist for this unit.
Hi, Mr. Taylor, back again. Mrs. Taylor, in case you don't remember, I'm Trish Hendricks, your husband's nurse today. Mr. Taylor, we'd like to go over a short summary of your discharge home.
Yes, Mr. Taylor, we'll first start with a review of the facts and information and events pertinent to your care, and we'll also discuss plans to get you ready for discharge. I have to ask you, are you okay with having this conversation in front of everyone here present?
Sure, it's good that my wife is here so that she can hear the plans too.
Okay, Mr. and Mrs. Taylor, I'm going to go over a short summary of what we've been doing to care for you here in the hospital. Please stop me if you have any questions. I'm going to give you this pad of paper and a pen. If you think of any questions, please write them down and we will answer them after our discussion. Also, I'll write down the goals for you on the whiteboard.
Okay, thank you very much.
Mr. Taylor is 63 years old. Mr. Taylor, as you know, you were admitted 3 days ago with an acute exacerbation of CHF. You have a history of COPD, CHF, coronary artery disease, and hypertension. You came into the emergency department very short of breath. He had bilateral crackles and 3+ pitting edema in both lower extremities. He was given several doses of IV furosemide and slowly improved.
Mr. Taylor, you've been here now for 3 days. Based on your exam when you came in, your test results, and how you've responded to the treatment, it looks like you had an exacerbation of your heart failure. Now, that's why you were so very short of breath, why you got tired so easily, and why you had to sleep sitting up at night just so you could breathe.
Are you saying that he had a heart attack?
No, Mrs. Taylor, I'm sorry. I used some medical terms there without explaining what they mean. Your husband did not have a heart attack. He had an acute episode of worsening of the symptoms of his congestive heart failure. Now, congestive heart failure, which we refer to as CHF, means the heart's struggling to pump enough blood to the body. Extra fluid collects in the lungs, making it harder to breathe, and harder to get oxygen to the body. So to summarize, when a person has CHF, they can go through periods of worsening of their symptoms. Extra fluid collects in the lungs, affecting their ability to breathe, and there's swelling in the legs.
He did have difficulty breathing, and his legs were swollen.
Now, Mr. Taylor, since you came into the hospital, we've been giving you more furosemide, sometimes called the water pill, to help you clear out the extra fluid that's collected in your lungs and your legs. And we will also adjust the amount of furosemide that you'll be taking at home to continue eliminating that extra fluid.
Okay, so his legs were swollen and he struggled to breathe because his heart isn't working well. Now, I was really scared for him when he struggled so hard to breathe. I'd never seen him have that much difficulty before. But I am so glad that he's doing so much better now. It's almost like he's back to his old self.
Yes, he is breathing much more comfortably, and we've been able to decrease his oxygen.
I agree, you do look much better now. Did you have any trouble sleeping last night? And how about your breathing during the night?
I actually slept pretty well last night for the first time in quite a while. I didn't have to sleep sitting up, and my breathing was really easy.
Well, I'm glad you're feeling better, Mr. Taylor. When I examined you this morning, your lungs sounded good. There was no sound of any excess fluid in there, and your heart sounds were normal too. Now, would you mind if I took another look at your legs to check for swelling?
No, not at all. Go ahead.
Okay, excuse me. All right, well, there's no sign of any more swelling there. This is good. Trish, what was his weight this morning and his fluid status?
His weight this morning was 168 pounds. When he was admitted 3 days ago, it was 178. Your usual baseline weight is about 169 pounds, isn't it, Mr. Taylor?
Yes.
He is on fluid restriction with limited intake of 1.5 liters daily, and he's been doing well, dividing his oral fluid intake over the day.
Yes, they don't let me drink any extra fluids. That's really hard on me, though.
Yes, we understand that it must be hard for you to feel thirsty all of the time. Dr. Terry, can we increase Mr. Taylor's fluid by another 500 milliliters a day now that he's been stabilized?
Yes, we can increase your fluids to 2 liters a day now. Mr. Taylor, I'd like to go ahead and listen to your heart and lungs again, if that's okay.
Sure.
All right.
Could you help
Would
me
you,
out there?
would you sit up for me, please? Thank you very much. Start with your lungs. Just give me good deep breaths when I touch you with the stethoscope, okay? Just lean back, please. Check your heart sounds. Just breathe normally. Well, everything sounds good. Trish, what was his BP this morning?
His BP was 135 over 85, and the rest of his vital signs and blood chemistry test results were normal this morning.
Chemistry tests?
Sorry, this is just a term that we use to refer to blood tests that we do to check your kidney function and different levels of salts in your blood, like sodium and potassium. Sometimes these can become imbalanced with some of the medications that you're taking.
Okay, I see. Thank you.
Okay, Mr. Taylor, you've responded well to the new medication plan. You do look much better. And all the signs we look for, your breathing, your lung sounds, your edema or swelling, all look much better. But Mr. Taylor, to kind of switch gears here, I realize you've been visited by many of us over the last several days. And we've given you a lot of information. I just would like to find out if we have been giving clear explanations about what we think caused your current admission. Can you tell me in your own words what your understanding is of why you had to come into the hospital this time?
Well, I'll try. My heart's a pump that circulates my blood and keeps me alive. When the pump is weak, well, things get backed up and it's hard for me to breathe and my legs swell up. Also, if I eat things that are highly salted, I retain fluid and that overwhelms my heart pump. So I really need to pay attention to what I eat. Also, I get confused with my medications. It's really difficult to do things the way I'm supposed to do them.
Mr. Taylor, when you say it's hard to keep up with all of the right things, can you explain to me a little better so we know how to help you?
Well, I know I need to make some changes. I need to take my pills and weigh myself and watch what I eat. Maybe, read the food labels more. But when we go out to eat at restaurants, they don't have food labels on the menus. Maybe we shouldn't go out, I don't know. And that DASH diet is really complicated, isn't it, honey? Don't you think?
You know what, dear? We can plan ahead a little better.
The DASH diet does have a lot of recommendations and information.
I have it here. So let's see. So if I eat more fresh vegetables and chicken with no added salt, would that help?
Yes, that would be a great idea. We can also arrange for the dietitian to come in again and review it to you before you go home.
Oh, that would be great. You know what, Alex? We can take a copy of it with us when we go out to eat. And we can use it when we're planning our grocery list.
That's a great idea, but I don't want to be a bother doing grocery shopping.
Alex, you're not a bother. Besides, eating healthy would benefit me as well. And I want you at home, not in the hospital. We are going to have to check your weight every day, though.
Okay, we'll teach you how to use a weight chart, which I'll review with you a little later. You will weigh yourself every morning at home. It will not only help you track your weight, but more importantly, you'll be able to track your fluid retention. It is important for you to weigh yourself every morning after you get out of bed and after you go to the bathroom. But be sure to weigh yourself before you eat breakfast and before you take your morning pills. We will ask you to use this weight chart to write down your weights, and then you can compare your weights over time.
What do I do if my weight changes?
If your weight starts to increase, it is a sign that you might be retaining fluid. One of the things that will help you manage all of these new things is the remote home monitoring program. After rounds today, I will come back and go over the details with you. I will give you guidelines on what to do if your weight starts to increase. Is that okay with you?
That's great. Thank you.
Thanks, Trish. I'd like to take a few minutes to review your medications, including the changes in doses which we are making and when you should take them. But let's wait until after the morning patient rounds so that I can take as much time as I need with you. Is that okay?
Yes, of course. That'll be fine.
Okay, I'll be back later this morning. I have some ideas about how to help you remember to take your medications. Also, I called your local pharmacist about having all your medications refilled and ready at the same time each month.
Okay. We'd really appreciate learning more about how to manage the medication schedule at home.
Thank you both for your time.
Well, thank you very much.
Thanks a lot, all of you.